Today we will be discussing the assessment of immune function. The function of the immune system is to remove foreign antigens such as viruses and bacteria and maintain homeostasis within the body. Immunizations serve to bolster antibodies when given. Immune responses can include the natural or innate immune response. That is the first line response because it protects the host without remembering prior contact with the infectious agent. It is a broad spectrum defense. It's a quick response and it is present at birth. There are two types of acquired or adaptive immune responses. The first is active acquired immune response. This is from vaccination or contracting a disease by the body generating a protective immune response from past exposures. The second is passive acquired immunity. It is temporarily acquired, such as from the baby's immunity in utero through breastfeeding. An overview of immune disorders include autoimmunity, and this is when a normally protective immune response paradoxically turns on the body. An example of this is lupus or rheumatoid arthritis. Hypersensitivity is the body producing inappropriate or exaggerated response to specific antigens, for example, anaphylactic shock. Gammopathies is the overproduction of immunoglobulins, which are also known as antibodies. These antibodies attack antigens such as viruses or bacteria. Primary immune deficiency results from improper development of immune cells or tissues, and this is usually genetic. Secondary immune response results from some interference with an already developed immune system, and this is usually acquired later in life, such as HIV and AIDS. Here is a list of assessments that nurses typically go through. It is important to especially note any childhood and adult vaccinations the patient has had, and for allergies, if a patient has been admitted with a previous allergy, to note what type of allergic reaction that patient had. Diagnostic and evaluation can include blood tests, skin tests, and bone marrow biopsy. Blood tests can determine if you have a normal level of antigens that are infection-fighting proteins in your blood. Bone marrow biopsies can determine if there is sufficient white blood cells. And skin tests, for an example of this is your TB test, and that is to see if there is an immune response. This chapter will cover immunodeficiency disorders. Listed here is the pathology of infection if you need to look that over as a reminder of what you learned in anatomy and physiology. On a vascular level, infections can cause edema, and on a cellular level, it can cause an increase in white blood cells. Normal white blood cells count is 4,500 to 11,000. It's edematous or swollen, it's tender, it's warm, and covers the entire right left quadrant, and it's erythematous or red. Some signs and symptoms of infection include heat, pain, edema, fever, and leukocytosis. Leukocytosis is an increase in the number of white blood cells in the body, especially during an infection. The physical assessment, we've gone over what is listed here, except for the ESR, the erythrocyte sedimentation rate. It is a non-specific measure of inflammation, and it measures the rate at which red blood cells sediment in 1 hour. Blood cultures are drawn as well. They must be drawn before the antibiotic is given, or the cultures will not be accurate. Nosocomial infections are healthcare associated infections manifesting after 48 hours of hospitalization. Some common causes include catheter associated urinary tract infections, pneumonia if the patient is not given the incentive spirometry during their stay, and surgical errors due to lack of timeouts. The Center for Disease Control dictates the standard precautions for airborne patients, droplet patients, and contact isolation patients. You need to review, from what was covered in lab, the personal protective gear that goes with each type, airborne, droplet, and contact. Some examples of patients that would require contact isolation includes MRSA and shingles. Contact Plus includes C. difficile. Droplet patients include pneumonia, meningitis, respiratory MRSA. Airborne includes TB, measles, and chickenpox. Here are some NANDA nursing diagnoses for you to go over.